Hello student, today we will discuss about treatment modalities for cancer. Surgery is already discussed in a previous video. Today we will discuss about radiational therapy. So surgery is always not the first phase of treatment. There are many treatment protocols are there, and in that radiation therapy also one. 60% of the client suffering with the cancer will receive radiation therapy at one point. So radiation therapy or radiotherapy means it is ionized radiation providing as a part of treatment. So what's the meaning of ionized radiation means? It is a form of energy. Selected dose of energy is passing to the client in order to kill the cancer cell. So radiation therapy, it may be given as a primary treatment, adjuvant or supportive treatment, or palliative treatment. What's the meaning of primary treatment? There are many clients, they are contraindicated for surgery as well as other therapy. So in such condition, the client is treated with a radiation therapy only. Means the first line of treatment is a radiation therapy itself. The second one, adjuvant or a supportive treatment means the radiation therapy is given before the surgery as well as after the surgery. Why before the surgery? In order to kill the cancer cells and burden the load of cancer cells. So it is easy during the surgery for doctors. So after the surgery, see, during the surgery, doctors will try to remove as much as possible cancer cell, but it may not be possible to remove. Here and there, a few cancer cell will remain hiding. So in such condition, after post treatment, after the surgery, they will give a radiation therapy to kill remaining cancer cells. So what is palliative treatment? In case of if client is in a third or a fourth stage, if the client is having severe pain or a pain due to obstruction, in such condition, by giving this radiation therapy, they will kill the cancer cell and helping the client to relieve from his symptoms and helping to lead a quality life and helping his increasing his lifespan. Okay, what is the main goal of radiation therapy? The goal of radiation therapy to destroy cancer cell or slow their growth by damaging their DNA. When DNA is damaged, what happens? The reproduction process, means the multiplication process will not take place fast or will not take place. So at least the burden of cancer cell will be reduced. So how radiation therapy works? Radiation therapy is a form of selected dose of energy, means ionized radiation, already I explained, which will destroy a cell's ability to reproduce by damaging its DNA. Means destroying mitosis. Mitosis means reproduction, means the 2 will become 4, 4 will become 8. So it's a multiplication. So it will be destroyed. So the cancer cell, how much is it, that much it will remain, but the multiplication process will not take place. Okay, what are the types of radiation therapy? There are mainly two types are there. One is external beam of radiation therapy. Second one is an internal beam of radiation therapy. So what's the meaning of external beam of radiation therapy, or it is called as a teletherapy? Means the client is placed somewhere and the instrument, the machine is kept, a radiation therapy instrument is kept away from the patient and targeting the part of the client. Means the machine will be away from the client. Radiation source placed at some distance from the targeted part of the client. It is not inside, it is outside and away from the client. Second one is internal radiation therapy or a brachytherapy. Here, specially prepared radioactive isotopes directly placed near the tumor. So, there are two ways there: sealed source of radiation therapy and unsealed source of radiation therapy. Sealed source of radiation therapy means the specially prepared applicator will be there. So, inside that applicator, the radioisotopes are placed. So, there is no chance of leakage of that radiation outside the organ or in a circulation. So, they will place this sealed source of radiation therapy near the tumor or inside the tumor and destroy the cancer cell. The second one is an unsealed source of radiation therapy. The word itself tells unsealed means it will be in the form of a liquid. So, radioisotopes can be administered in the form of IV, orally, or by instillation directly into a body cavity. It will be in a colloid or suspension form, means it will be in a liquid form. What we are giving in a, like sometime we will inject, through the injection we will give it. See, in a picture you can have a look. The first one is a external beam, means the patient is made to sleep and the machine is away from the patient. In a second is a internal. See, you can see here the isotope is placed inside the tumor cell only, and that is a sealed. Unsealed is a this radiation therapy given in the form of injection. Okay, what are the side effects of radiation therapy? It is a very important. Every nurse should know the side effect of radiation therapy. So, when a client is posted for the radiation therapy, it's a part of a nurse's responsibility to prepare the client and to explain the side effect in a rational way in order to make them to accept it. So, skin reaction, mild erythema will be there, means redness, sometimes burns will occur. Fatigue will be there, means tiredness, mucositis, esophagitis, means all type of itis, infection will be there, top to bottom. Xerostomia means dry mouth will be there, so should encourage the client to have a more fluid. Dysphagia, difficult to swallow, nausea, vomiting, diarrhea. Tenesmus, straining at stool or a urine, means very difficult to pass it. Put underline for that. They may ask for the 1 marks. Even xerostomia also they may ask. Okay, cystitis, urethritis. Cystitis means inflammation of the bladder. Urethritis means inflammation of the urethra. Alopecia, hair loss. Put underline for this. They will ask. Bone marrow suppression. When bone marrow suppressed, what happens? The bone marrow is unable to, see, the bone marrow is called as a cell storage center. So, it produces red blood cells, WBC as well as a platelet. When bone marrow will suppress, all these cells are declined, will reduce in count. So, infertility, inability to have a child. So, inability to give a baby if it is a male person means. So, these all the major side effect of radiational therapy. So, what are the nursing management of a client, one who is receiving radiational therapy? The nurse has to prepare the client before receiving radiational therapy as well as after receiving also. Providing everything should be in a rational way, in a you should not make the client to undergo panic stage, okay? Very rational way, should give a health education, psychological support throughout, before, after and until whenever she comes to the casualty area as a outpatient department to receive the therapy. Not only for the client, even family member also required. Explaining all the side effect, coping mechanism like mind diversional therapy, and making the client to accept all that side effect, because the client has to accept, because the client has to undergo for the chemotherapy. First you have to make the client to accept for chemotherapy. The second one is to accept the means a side effect. The third one is a coping mechanism, how to cope by through mind diversional therapy. There are various activities are there, not going on thinking about that only. To avoid that, mind diversional therapy, reading some good books or engaging with some kind of activities, art making, like woolen sewing or any kind of stitching, all that things. Advise the client to avoid close contact with children and pregnant ladies, because that radiation effect will be there in a client. So, when come across this, especially the vulnerable group, a child and a pregnant ladies are more prone, so should stay away from them. Encourage follow up when doctors say whatever at a particular time to visit the clinic, the client has to, and with the CBC report as well as other, if doctors say other blood report, and not to neglect it. It is a must to know the blood count and all. Education and emotional support to entire families. So here we should consider not only the client, entire family we have to consider, and we have to counsel entire family. So however, the client has to take a radiation therapy. So in a very, by explaining rational way, you have to make them to accept. So now next we will move on a chemotherapy, that is in a next video, the part 6 I will explain. Thank you, student.